Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before we begin, I want to thank everyone who made safe choices over the long weekend. This includes the more than 16,000 people who went to get tested this weekend, and the over 86,000 people who rolled up their sleeves to be vaccinated. Most of all, thank you to everyone who respected the public health restrictions in place and followed the rules over the May long weekend. I do want to note that unfortunately, over the long weekend, we saw a small increase in people not showing up for their vaccine appointments. A 1 to 3% no-show rate is typical, but AHS noted the provincial no-show rate rose to over 4% over the last 3 days. This is likely related to the long weekend and the wonderful weather we had, but I want to remind people the importance of cancelling their appointments with AHS or pharmacies if they are no longer able to attend them. Cancelling or modifying your appointment is easy to do online with Alberta Health Services or by calling HealthLink. Pharmacies can be contacted online or phoning them directly as needed. These no-shows are not resulting in vaccine wastage, but they do take an appointment from someone who wants it, and they slow down our ability to vaccinate people as quickly as possible. Turning to today's update. Over the last 24 hours, we have identified 387 new cases of COVID-19 and completed about 4,000 tests. Our positivity rate currently stands at 9.9%. There are now 565 people in hospital being treated for COVID-19, including 158 in the ICU. Sadly, I must announce that 9 new deaths in people between the ages of 42 to 84 were reported to Alberta Health over the last 24 hours. My deepest sympathies go to the family, friends, and other loved ones of those mourning the loss of these individuals and anyone who has lost a loved one to any cause over the last few months. Preventing severe outcomes is why we need to keep working together to stop the spread of COVID-19. We have now administered more than 2.55 million doses of COVID-19 vaccine. We continue to see remarkable uptake across the province, and I hope that we can keep this momentum going. The more people who get immunized, the more successful that we will be at preventing waves in the future. With more doses coming in, we are actively looking at more ways to reach key groups who may be having trouble accessing vaccine. We are also looking at our current 16-week timing for second doses and when we can begin to shorten that window based on incoming supply. I hope to be able to update you soon about second dose timing. It has now been 3 weeks since our latest health measures were announced, and I know that they have impacted all of us. Yet the numbers show that our collective efforts are making a difference. The reproductive rate in Alberta, or the R value, over the last week was 0.67. This includes 0.62 in Calgary zone and 0.71 in the Edmonton zone. We have seen a steady decline in new cases across the province, which is helping bring our active case count down as well. In fact, active cases have declined 52% from their peak earlier this month. We are now seeing promising declines in hospitalization numbers, and although it has rebounded a little bit in the last few days, we have started seeing our positivity rate decline as well. This is yet another reminder that our actions matter, and collectively we have the power to bend the curve down and get us past this third wave. I know making this kind of impact on the spread of COVID-19 isn't easy. It requires millions of people making sacrifices every day. After almost 15 months, I know this is a tough time for us as a province. They say that the last few miles in a race are the hardest, and that is what we are facing right now. With cases declining and more vaccines being administered every day, we are rapidly approaching a point when we can safely begin to ease measures. It's close and getting closer every day. After such a long pandemic, it's natural for all of us to be eager and anxious for that day to arrive as quickly as possible. But though active cases have declined remarkably in recent weeks, there are still more than 12,000 active COVID-19 cases. That's the same number we had in mid-January. We are getting close, and the best thing that we can do to drive the spread down further is to step up for vaccines and follow the public health measures. The more that we can reduce transmission, the more effective vaccines will be in protecting our communities when we start to ease things up in the near future. I know you've heard it countless times, but we need to continue protecting each other by minimizing close contacts for just a short while longer. We know the rules in place are working. Our recent numbers show this. That progress and the increasing percentage of Albertans stepping up to protect themselves and their communities through immunization will allow us to start safely getting back to normal as soon as possible. Thank you, and I'm happy to take questions.
All right, we have a very full queue, but we'll try and get through as many as possible. Operator, could you put through the first caller, please?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. The Alberta Teachers Association has been calling for improved outdoor air exchange and ventilation and filtering in schools. Are you concerned about COVID's travel in the air in Alberta schools?
We know that when there are many people together in indoor environments where there's very poor air circulation, that can contribute to an environment where it is possible for COVID-19 to spread. We also know that the interventions in place in schools, we have seen showcase their effectiveness over the last year when we have community transmission rates that are low and declining. And so we have seen it on numerous occasions over the last year, the school transmission being a direct outflow of what our community transmission is like, and not a major contributor to community transmission. It is always, of course, important to consider all different protective measures that minimize the risk of COVID-19 transmission, but there's no one single measure in isolation that would be sufficient. So it is a combination of all of the things that are in place with respect to regular screening, regular mask use, ensuring that groups are cohorted together, ensuring that distancing is taking place wherever possible. All of those things together are an important part of the package. And of course, where there is a potential to increase air circulation, that is an important part of adding to that overall package.
Kevin, is there a follow-up question?
Yeah, on the weekend, the Premier tweeted, quote, "The people that are getting ill and hospitalized now are overall younger and without compromising health conditions because we took steps to protect vulnerable Albertans first. That strategy has worked. Now we just need to get everyone else vaccinated," end quotes. Was your strategy really to see more young people in hospitals?
It's really important to distinguish the different parts of the strategy. We know that those who are older, those who have medical conditions that put them at higher risk of severe outcomes, if they are infected with COVID-19, they have a much higher risk of needing hospitalization, potentially ICU care, or sadly those who go on to pass away. The strategy was very specifically to protect those who are at the highest risk of severe outcomes as a priority, and we've seen that strategy result in lower overall hospitalizations as a proportion of our cases in this third wave. Of course, we never want to see anyone go on to have a severe outcome. So the strategy, again, was to make sure that we were able to offer vaccine to everyone as quickly as possible, but to do that early on when we had limited supply to protect those most vulnerable, and then as supply advanced and came in, to be able to offer that to all Albertans who could benefit from it. So again, the strategy was to ensure the maximal benefit of vaccine to those who needed it most. And now we are in the excellent position of being able to offer it to all Albertans, and again, wanting to emphasize that no one is at zero risk, and that vaccine is an important protective measure for everyone of any age, 12 and over, and whether or not people have compromising health conditions.
Operator, could you put through the next caller, please?
Next is Bill Kaufman with Post Media. Go ahead, Bill.
Yes, Dr. Hinshaw. I'm just wondering if you could tell us anything about what kind of uptake on vaccinations we're seeing for the youngest eligible recipients. And are there any concerns that parental hesitancy might be impacting, those numbers at all?
On our website, we actually have uptake of first and second doses by age group, so you'll be able to see the most recent coverage for all different age groups. If you look at the vaccination data tab under the COVID statistics information on our website, we are seeing that those who have just recently had eligibility for vaccine, those youngest age groups, do have a little bit of a lower percentage of coverage. It's hard to say at this point how much of that is hesitancy and how much of that is just a timing fact. Again, we've only been able to offer vaccine to those younger age groups for a couple of weeks, as opposed to many of the other age groups who've had the opportunity to book appointments for many months now. And so again, we're looking to make sure we're using every opportunity to offer information and resources, both directly to Albertans, as well as working with different partners and stakeholder groups to ensure that as parents are making decisions about themselves and their kids, or others are making decisions about vaccination for themselves, that they have access to the most up-to-date, reliable information to make those decisions.
Bill, is there a follow-up question?
Sure. Dr. Hinshaw, do you have any concerns that, the delay in announcing vaccine mixing could, delay or disrupt the vaccine rollout here?
We know that those who received AstraZeneca as their first dose are eagerly awaiting information about the possibility of mixing different vaccine types in a series, so getting a different vaccine type for a second dose than the first. But I also know, after speaking with my colleagues, that the other provinces that have started thinking about booking second doses for those who received AstraZeneca are looking at a minimum of a 12-week interval because of the data that indicates that the immune response is likely best with that longer interval between first and second doses. And in Alberta, we know that 12 weeks from the time of the very first doses of AstraZeneca is June 3rd. That's the time that we would be hitting that 12-week mark for those Albertans who first received AstraZeneca. So we do have a little bit of time, and we anticipate having the results of the UK study on vaccine mixing very soon to be able to offer Albertans the best current evidence as they consider options for that second dose. And so again, I don't anticipate that it will delay the rollout. It's just wanting to make sure that we have the benefit of the best evidence as we're making those options available for Albertans.
Operator, could you put through the next caller, please?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. I'm wondering about the demand for vaccine. The vaccine program has been opened up to everyone in the province for a couple of weeks now. What are you seeing in terms of demand? Are there any signs that demand for new appointments is waning, or that we're hitting a wall now that kind of the first crush of people who really wanted it have signed up, and there's other people that maybe are waiting on the side?
As of now, we still have quite a high demand for the current vaccine availability, with hundreds of thousands of appointments booked in the next several weeks. And so again, we're trying to calibrate the incoming supply with that demand, and that is part of the decision making around the timing of second doses. But in terms of let's say this week and even moving into next week, we still have very high demand for available appointments. And again, I would encourage those who are perhaps have been thinking about making an appointment and haven't quite connected with either a pharmacy or AHS or a participating physician's office to make that happen. It's important to do that as soon as possible so that we can both protect the community, and also, as we're considering timing of second doses, we want to make sure that we have as many people with that first dose as possible before we move into the second dose opportunities.
James, is there a follow-up question?
Yes, and looking at the various ages, really high coverage for people 70 and up, even 65 and up. But then we get to like people in their 50s and early 60s that have had access to vaccines for really quite some time now, and we're still seeing rates 66% for people 50 to 54, a bit higher for the next age group. Like, what does that tell you about the demand? If there are people that have been eligible for over a month now, and we're still seeing the uptake at kind of 2/3.
Again, it's important to remember the time stamps of when people became eligible. So those who are 65 plus have been eligible for vaccine since late March. And then moving through April and into the beginning of May, the majority of eligibility was really about those high-risk settings. So often looking at healthcare workers, for example, looking at correctional settings, at shelters for those experiencing homelessness, group homes. So there was a whole series of occupational setting as well as caregivers. And all of those groups we moved through before moving into the 50 to 64-year-olds and then opening up to those lower age groups. So even though it has been several weeks now since those who are 64 and younger have had access to all different products. Of course, those age groups would have been able to choose AstraZeneca earlier, but for those who wanted an mRNA vaccine, they've only been eligible again for several weeks now. And we've seen, even in that oldest age group, there's typically a rush initially, and then the numbers increase more slowly over time. But even in that oldest age group of those 75 plus or 65 plus, we continue to see incremental gains after that first major surge of interest. And again, I would emphasize that we're seeing that uptake. We're seeing it in places across the province, and we still continue to see that good demand, being able to utilize the vaccine that's coming into the province.
Operator, could you put through the next caller, please?
Next is Licia Corbella with Post Media. Go ahead, Licia.
Thanks. Good afternoon, Dr. Hinshaw. As you know, the U.S. border has been closed to Albertans who were driving into Montana to get a first or second Pfizer or Moderna shot for free, thanks to the generosity of the Blackfeet Nation. I'm just wondering, that was such a lovely feel-good story, and it was happening across the country, of course, but I'm just wondering what you think about this program being shut down and what your understanding is as to why it was shut down, and whether or not, like the Public Health Agency of Canada reversed its decision on this. And I was wondering how you feel about that. Are you disappointed that this has happened? And do you agree with PHAC that COVID-19 vaccines represent non-essential medical care, which is what they said?
Certainly, I'm grateful to the Blackfeet Nation for offering vaccines to those from Alberta. The conversations about setting that up and then the changes that were made were really all made at a national level. So we weren't involved in those conversations. That really was a federal decision about border management. What I would encourage Albertans, certainly if there's anyone who hasn't received a first dose, we have appointments available, so they wouldn't need to travel for that. And of course, if people are keen to get their second dose sooner, and some may have been traveling down to get their second dose, again, we anticipate having more information soon about when second doses will start to be booked. And the considerations of essential, non-essential, those specific questions, again, I was not involved in those discussions, and that really was a federal decision.
Licia, is there a follow-up question?
Yeah, so I just wanted to probe a little bit further on that, because we have the Public Health Agency of Canada saying that the reason why Canadians cannot go across the border to get a vaccine without then having to quarantine is because COVID-19 vaccines are non-essential medical care. And I'm wondering if you believe that COVID-19 vaccines are non-essential medical care.
Again, I can't speak to the federal decision and whether part of that is determining whether or not the care that's received outside the country, whether or not it's possible to receive it inside the country or not. Of course, I would believe that COVID-19 vaccines are life-saving and critical. But again, I'm not sure what all of the tests are that the Public Health Agency of Canada uses in terms of determining the availability within or outside of the country as they apply those tests. So that may or may not be something that they've considered. But of course, it is critical that as many Albertans as possible choose to protect themselves and their communities by receiving vaccine. And again, those technicalities and details of how the Public Health Agency of Canada assessed that, I wouldn't be able to comment on.
Operator, could you put through the next caller, please?
Next is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hi, Dr. Hinshaw. Going back to the AstraZeneca, you had mentioned that June 3rd would be 12 weeks from the first doses given out. So I guess we've heard a lot about mixing and matching. I guess we know that there's about 8,000 doses of AstraZeneca left that are saved for second doses. I'm curious how that rollout would go and if there's plans on when that would start.
Sure, and again, we're really looking to the data from the UK studies to look at the immune response when someone receives first dose AstraZeneca, second dose of mRNA vaccine, to be able to inform how we structure the second doses for those who started with AstraZeneca. So final decisions, again, will really depend in part on what that data shows and what options we're able to offer. But we do have, as you say, the little more than 7,000 doses currently in stock, and would be able to request additional doses should we need them. But we want to make sure, as some Albertans, if the data shows that a second dose with an mRNA vaccine is effective and safe, some Albertans may wish to choose that mixed schedule and others may wish to receive AstraZeneca. And so we want to make sure that we don't order more AstraZeneca than we're able to use, given that each vaccine, each COVID-19 vaccine is a precious resource and we wouldn't want to waste it. So again, as soon as we have that data, we're able to make the decision and provide the recommendations and options to Albertans, then that will inform the need to order potentially additional doses of AstraZeneca. But I want to be clear that those who received AstraZeneca as a first dose will have an opportunity to have a second dose. And again, we'll base what options we might be able to provide on the data that comes out of the mixing trials that are happening in the UK.
Dylan, is there a follow-up question?
Yeah. The Premier tweeted out, I believe it was yesterday, that there's exciting news this week about the great Alberta summer that lies ahead. I'm curious if you have an exact date for when we'll be getting news about the reopening plan, and then, you know, going into that decision of releasing the plan, I'm curious what benchmarks you're specifically looking at. I know that we're looking at vaccination rates and hospitalization rates, but are there specific benchmarks that you want to see before we're allowed to, you know, reopen and start moving back towards a normal summer that we've heard we might be able to get?
Sure, you can expect the details about the specific benchmarks and the types of activities that are associated with them that, you know, should be available once finalized, again, as the Premier tweeted this week. And those specifics, again, are really critical to note that the more Albertans who choose protection through immunization for themselves and their communities, and the faster we're able to get those doses into arms, as well as the more we can prevent transmission of COVID-19 and therefore reduce that impact on hospitals and ICUs. I think, again, it's critical to know that we are driving transmission down and enhancing vaccinations up. And those specific numbers, of course, will be forthcoming, but it's very clear, again, we all know what we need to do to reduce transmission. We've been doing it for a long time. So the more we can do that in the coming weeks, the more successful we'll be able to be in moving towards the kind of summer that we all want to see.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Next is Bill Fortier with CTV. Go ahead, Bill.
Hi, Dr. Hinshaw. You said earlier that we're seeing remarkable uptake across the province when it comes to vaccines. Looking at the map, I see some areas are 50, even up to 60% of the entire population, but high level is at 11.3%, and that's for that entire region. Certainly not remarkable, unless, remarkable maybe in a bad way. What's going on up there? What do you attribute that to?
It's important to know that in some particular areas, there's different population structures again. So in some places we see they have a higher proportion of the population that's younger. So sometimes that overall vaccination rate is impacted by that. We also know that as data comes in, sometimes we're able to adjust. So sometimes the doses that are reported to us do take a little while to get in. So again, whether or not there's a bit of a reporting lag in some areas. But we also know that in some locations, again, we need to provide a little bit more effort to make sure that we're addressing any barriers that might exist. So barriers with respect perhaps to vaccine availability, perhaps barriers with information, or making sure that people have access to information not just from formal channels, but providing it through local channels such as healthcare providers who are a trusted source of information. So we're working to ensure that low areas across the province have extra attention paid to make sure that we're eliminating any barriers that we can and making sure that people have access to the information, to the vaccine in an easy way. And again, ensuring that while vaccine remains a personal choice, that people make that choice in an informed and supported manner.
Bill, is there a follow-up question?
Yeah, just to follow up on that question specifically. So you're saying in some cases the stats are skewed by the numbers, and in some cases the province needs to do a better job. In high level, which is it? Does more need to be done? Are the numbers really that low, or the numbers skewed by the population? And what does need to be done up there to change that? And what's the wider impact on the province if one specific area has a very low rate of vaccination? How does it have a wider impact?
I don't have the specific breakdown of all the different areas of the province that are sitting lower than the average, so I'm not sure exactly about high level. I would guess that there is a mix of both. I think from the last time I looked at the demographics that that area does tend to be a little bit younger. And I also believe that there's opportunities for us to be able to enhance approaches in that particular area. So again, we're working to make sure that it's not just a one-off approach, but that we're looking strategically across the whole province and ensuring that we are doing everything we can to increase the accessibility of vaccines. With respect to the provincial impact, if there's one particular area that remains quite low, again, I think that it's important to remember that while vaccine uptake is one component of the level of protection, we also know that while it's not as robust or long-lasting, there is a measure of protection provided by having had an infection. So those are the kinds of things, again, that have been taken into account as we're looking at our targets for protection. And while I would encourage anyone who has had COVID-19 to receive a vaccine to make sure they are as well protected and protected in as long a lasting way as possible, we also can't discount or ignore the fact that there is some protection from that infection level, which again, for some regions where there may be more infection that's happened, there may be, again, that combined protective effect.
Operator, could you put through our second last caller, please?
Next is Lauren Pullen from Global Calgary. Go ahead, Lauren.
Hi, Dr. Hinshaw. Thanks for taking my question this afternoon. This is a follow-up to James's question on the overall potential slowdown of vaccine appointment uptick. There have been several anecdotes of pharmacy spots not being filled across Alberta. I know you said that you have seen a lot of vaccine appointments booked, but are there still a decent amount of spots open? And at this point right now, are we still at the beginning of June for those second doses, or when will we find out that concrete date?
We know that there's opportunities to be able to provide people with potentially an earlier dose. So for example, I'm aware of some communities where perhaps one vaccine provider has open appointments and other vaccine providers have their spots all booked up for a week and a half. And so we have been working with some of those communities where one provider indicates that they do have open appointments to see if in that local community, those who want a vaccine and are booked for it but weren't able to get an appointment at that one location for perhaps a couple of weeks, that we can shift around some of that demand to make sure that we're utilizing vaccine as quickly as possible. So that's one area that we're working in. With respect to second doses, again, I don't have a fixed date as to when we'll be able to make those second doses available, but we are watching very closely at our incoming supply as well as the demand for first doses. And when we see that we've been able to offer first doses to the majority of people who want them, we can start easing in that opportunity for second dose appointments for those who received their first doses in March, and then work our way through the second doses for those who received their doses in sequence.
I believe those two questions, but Lauren, do you have a follow-up?
If I can, on a different topic. Thank you. BC released its full opening plan today, looking at vaccinations, case counts, and hospitalizations as their benchmarks. I know the Premier has noted that our plan will be revealed this week, but is BC's model something similar to what you've brought forward or discussed? And given what you're seeing in our benchmarks now, at what point do you see things starting to ease, even things such as outdoor gatherings being expanded to 10 people, or even allowing outdoor sports again?
We've looked carefully at the opening models from other provinces that have been released before ours was, as well as the experiences of U.S. states and other countries as they have moved forward with their opening plans to inform ours. And the details will be available later this week with respect to the specific benchmarks, and then the kinds of things that we'll be able to do going forward as we are able to ease measures once we achieve, again, the increases in immunization and that protection that it offers our communities, as well as the decreases in acute care burden, where we still have over 150 patients in ICU alone right now, which is a significant burden. So we do need to make sure that we're seeing those numbers decrease, immunizations increase, and then we can start moving into those easings.
Operator, could you put through our final caller, please?
Final question is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Doctor. I'd just like to ask a question and follow-up, and to do with the question that was asked last week by a reporter. Could you sort of in very general terms explain how we get from where we are now, where there are many businesses closed, and to a state where just weeks from now we have a Calgary stampede, which is preparing to be, except for some social distancing, there's still going to be lots of the rides and they're expecting lots of people. So just in very general terms, how do we get from a place where there is lots of restrictions to a place where it's near normal in just a period of a few weeks? How do you see that as kind of evolving?
What we've seen in the last couple of weeks is the combined impact of public health measures that reduce person-to-person transmission and opportunities for contact, as well as an acceleration of our immunization program with increased volumes of vaccines coming in. And so you may recall our decline in cases and hospitalizations when we moved past the peak of our second wave in January was a lot slower than what we're seeing right now. So the important thing to be able to reach that particular milestone of having a summer where we can have events like the Calgary Stampede, the important thing is that we don't ease off our collective efforts too soon. And if over the next several weeks we continue the very strong efforts that we have collectively been working on to bring our cases down, to bring transmission down, and subsequently the hospitalization in ICU, as well as continuing to ensure that our immunization program is reaching as many people as possible, as quickly as possible. With those two things combined, that will make all the difference in terms of being able to ease measures in a faster way than we've been able to before, because with lower transmission plus higher vaccines, that combination is the path that we have, the opportunity that we have to move to the other side of the most intense period of this pandemic.
Rick, is there a follow-up question?
Yes, again, it's because the Calgary Stampede is in the news a lot here in Calgary and area. What kind of restrictions need to be lifted in order to have a stampede that would include, let's say, a parade, that would include a lot of activity on the midway, rides, people taking rides on the midway, people going to venues, stampede venues for entertainment, people attending rodeo events, chuck wagon events, people going to corporate tents to socialize or corporate facilities to socialize during stampede. I mean, what kind of restrictions would have to come off in order to have that kind of a major event with all of the mixing and mingling that goes on?
It's important to remember that a lot of the stampede events are outdoor events, so that particular context does mitigate the risk of transmission in that outdoor context. But of course, the things that would need to be removed would be restrictions that are currently in place with respect to social gatherings, the restrictions currently in place with respect to audiences. And again, those kinds of restrictions, we will be able to contemplate easing them if we can collectively bring that transmission risk down and our immunization protection up. Then those are the kinds of things that we would be able to contemplate easing, not just for the Calgary Stampede, but for other events this summer, as long as we do this work together over the next month to be able to maintain that pressure on downward transmission and upward vaccines.
Thank you all for joining us. Dr. Hinshaw will provide another update later this week. Have a safe evening.